Welcome back, guys. Today we are going to look at nursing diagnosis for malaria. So nursing diagnosis, before you make it, you need to know the signs and symptoms according to the assessment. It is your assessment that will help you to generate the nursing diagnosis. So for malaria, we listed the symptoms as we have fever, convulsions, we have hypoglycemia, that is reduced blood sugar, we have anemia, lack of blood in the body, hemoglobin, headache, we have vomiting, joint pain, and fatigue, anorexia, that is lack of appetite or reduced urge for food, hepatosplenomegaly, that is enlargement of the liver. We have splenomegaly, enlargement of the spleen, blood in urine, jaundice. So those are the signs and symptoms, plus even the complication that we have got in malaria. We are going to look at the diagnosis for fever in malaria. We have hypothermia related to body response to circulating plasmodium as evidenced by thermometer reading of greater than 38 degrees Celsius. This one I've just put like for example, but for you will use the body temperature that is given in a scenario or you have taken from the patient. So number 2, we have hypothermia related to body response to saturation of toxin in the blood as evidenced by patient's hot on touch. So that's the evidence. Then we have hypothermia related to body response to saturation of the toxins in the body or blood as evidenced by patient shivering. If patient shivering does not mean that the patient is having coldness. So if the patient is shivering, get the thermometer, you'll find that the patient is hot. So that is on fever in malaria. So let's look at the nursing diagnosis for convulsion in malaria. So number 1, we have risk for injury related to uncontrollable involuntary muscle movement. So remember, if a person is convulsing, you cannot restrain, you cannot do what, you only monitor for the airway and then maybe you give sedatives. You cannot restrict, otherwise you'll cause more injury or the patient might fall into the fire depending on the place where the patient is. Then we have risk for brain damage related to abnormal shooting of impulse in the brain. Another one, we have risk for ineffective airway clearance related to presence of secretion in the mouth. Someone who is convulsing will always have secretion in the mouth, whether in terms of saliva, fourth. We have risk for aspiration related to presence of secretion in the mouth. A person can aspirate this because after giving the drug, things are paralyzed, the muscles are paralyzed, so the secretion can flow back to the airway. Let's look at the hypoglycemia in malaria. 1, acute confusion related to reduced glucose in the brain, evidenced by unaware of the environment. The patient is not knowing where he or she is. Remember, the brain survives on oxygen and glucose. Without that, when one is deprived, can get injury and total death. Then we have low blood sugar levels related to inadequate food intakes, evidenced by RBS of less than 3 millimoles per deciliter. Again, Yeah, it depends on the thing that they gave in the scenario or the one you have taken from the patient. Then you write. This one I've just given you in case you are making it. But risks for convulsion related to low blood sugar level. As I told you, brain feeds on oxygen and glucose. Now, let's look at the nursing diagnosis in anemia. Nursing diagnosis for anemia in malaria. So we have acute confusion related to reduced oxygen supply to the brain as evidenced by the patients unaware of the environment. Remember, as I told you, the brain needs oxygen and glucose. And in malaria, severe malaria that has anemia, the red blood cells has been destroyed by the plasmodium. So the brain will not be receiving enough oxygen. So ineffective tissue perfusion related to destruction of red blood cells by plasmodium as evidenced by pallor of the mucous membrane. So it is the red blood cells that transport oxygen. If they are destroyed, which means the oxygen will not be carried in sufficiently to the brain or to the tissues. To the brain and to the tissues. We have impaired gases exchange related to reduced red blood cells, evidenced by difficulty in breathing. Remember, even lungs are supplied by oxygen. So, if lungs are not also getting enough oxygen, plus the alveoli is not receiving, the red blood cells are supposed to transport oxygen are reduced, which means there's be difficulty in breathing. As you see those patients that have anemia, mostly they struggle with breathing. We have fatigue related to reduced oxygen in the body, evidenced by patients being weak. So, oxygen is essential things for the body because everything, burnout, metabolism, everything needs oxygen, all the activity. So, if they are not there, so the energy will not be produced well, the patient will lack that energy that is needed for the normal activity. So let's look at the nursing diagnosis for headache and joint pain in malaria. So number one, we have acute pain related to inflammation as evidenced by patients complaining of headache. We have acute pain related to inflammation of the joint, evidenced by patients complaining of joint pain. It's mostly body response to foreign body in the body. So if the body is reacting or responding to foreign body, we expect inflammation. Inflammation, headache, pain, those are as a result of inflammation. So we have disturbed sleep pattern related to pain as evidenced by patient not able to sleep in the night, or the patient will tell you, I'm not able to sleep. All in all, someone who have pain will not sleep. For sure, if you have pain, you will not sleep at all. Just have fatigue in the body in the during daytime. So we have fatigue related to disturbed sleep, evidenced by patients complain of generalized body weakness because the patient did not have enough rest, so the body also need to rest. The body is tired. Okay, let's look at the nursing diagnosis for vomiting in malaria. We have fluid volume deficits related to loss of fluid as evidenced by patients vomiting. Have electrolyte imbalance related to loss of electrolyte by vomiting as evidenced by patients being confused. So the electrolyte that are lost through vomiting, those are potassium and sodium. That is mostly. If patient has this, you need to replace them because it can kill very fast. Then imbalanced nutrition less than body requirement related to patient's inability to retain food as evidenced by reduced weight. So if you come to malnutrition also, when someone is vomiting or diarrheating, see even a patient who has over vomited will reduce in weight. So if it has continued for 2 days, someone will also become malnourished in 1 week time, minus being if action not taken. So that's why it is very important to check if someone is vomiting. Then we have risk for aspiration related to vomiting. So remember, if someone is vomiting, some people can vomit through even the nose. The vomiters can come through the nose. That's where the risk of aspiration also come in, because sometimes if you are vomiting through the mouth, you can breathe through the nose. If now you are vomiting through the nose and the mouth, it will become very difficult for you to breathe, and yet the body also need oxygen. Okay, let's look at the nursing diagnosis for anorexia in malaria. We have risk for hypoglycemia related to reduced appetite. So hypoglycemia is low sugar level. You need sugar to sustain the life and the energy. Risk for imbalanced nutrition less than body requirement related to reduced appetite. So for you to get the required nutrients in the body, there's only one common way, that is for you to eat food. So if the appetite reduce, there's no way you can intake the food, the nutrients that is needed. So nursing diagnosis for hepatosplenomegaly, splenomegaly, jaundice, and urinating blood in malaria. All these are complications of malaria. So now one, we have risk for bleeding related to jaundice. Remember, jaundice is a sign of liver destruction, liver not functioning well, and those bilirubin destroy the clotting factors. So when the clotting factor is destroyed, you have to know that things are now anytime getting worse. Then we have risk for liver failure related to destruction of the liver cells by the plasmodium. Remember, the plasmodium, they grow in the liver cells, and then they burst. If they continue, then they bring hepatosplenomegaly. If not treated, can cause liver failure. We have risk for infection related to destruction of the spleen. Spleen is one of the immune system that they fight against infection. If it is destroyed, it can also predispose someone to infection. We have risk for anemia related to urination of blood. So when someone is continuously urinating blood, the blood is being lost, and if no action taken, the person will go into anemia. And renal failure also. We have anxiety related to patient's condition, evidenced by mother crying. Mostly this one is for children. If a child is sick, the mother is always anxious, especially a serious disease. We have knowledge deficit related to lack of knowledge about the complication of malaria, evidenced by mother wondering if that is malaria. If someone has seen person urinating blood, they cannot believe that malaria is the one that can cause that. They can think of bewitching and other things. So knowledge deficit. So So we have knowledge deficit related to lack of knowledge about malaria, evidenced by attendants asking many questions. Okay, that is all. Thank you for watching and see you in the next one.